going to use this relieve a spin, little one-handed technology, so we'll be able just to do this all with one hand. Okay, so now we're up into that sinus cavity up in your right forehead. You're going to have a little bit of pressure when this balloon is slid up in there. Real tight fit there. Good job. It's all one-handed there. Easy to keep my hands in the right spot. Hey, Dr. Piper, one more inflation. Oh yeah, you feel that little cracking, then we'll pull this back in. Yeah, that was great. You did wonderful. That was great. Okay. So I'm going to put some more numbing medicine back on that right side. And then we'll go over to the left side. All right, same thing. Using the spin balloon guide. Again, the benefit of this is just be able to use just one hand.
Move your hair a little bit.
Just try to access that little frontal sinus opening. Okay, and so now we're up in the sinus cavity, and then again, just with one hand, I can just take it out, slide the balloon up in without having to take my hands off the equipment. Okay, go ahead and inflate. And then retract just a little bit. Not yet. Okay, go ahead and inflate for me. Nice, and we'll see that uncinate process start to even pull back away from the superior aspect, really opening that frontal outflow tract like we want. Okay, we'll retract the balloon and the light wire into the guide, and then out we go. You just gently slide right behind, atraumatically behind the uncinate process, rotate right in, and then again with the one-handed slide, just slide the guide, the light right in there. It's in the sinus cavity, and then here we'll just advance the wire with one hand. Advance the balloon, over the wire with one hand. Go ahead and inflate. I like to pull back so I can kind of see where the tip of the balloon is and make sure that the uncinate process is getting medialized. Helps me just with some tactile feedback. Go ahead. And the last one, I try to push back into a little further back and really try to medialize that uncinate process. You can see it kind of pulling in.